It is my absolute pleasure and honor to introduce you to one of the unique speakers who is heavily and intimately involved with the 2021 World Brain Day campaign. As you all know, this is World Federation Neurology social media team, World Brain Day team, and YouTube channel. And I am your host. Our guest today is Dr. Anne Helme, who is the Director, Access and Research for Multiple Sclerosis International Federation, who is our partner in crime for 2021 World Brain Day. As you all know, the campaign is running very well at this point of time, and we are incredibly grateful to have our partner as MSIF. Having said that, we're all working together to end or stop multiple sclerosis this year. And very good morning to you. How are you?
I'm very well, thank you, Tisa.
And thank you very much for the incredible support that we are getting from MSIF. But today, the discussion is slightly different. So tell us about who you are and how you got involved in multiple sclerosis and how you got involved in Multiple Sclerosis International Federation. You can go as far back as you want to your primary school, high school days, university days. We just wanted to know how Anne Helme was made.
Okay, so I'll start with my scientific background. So I suppose my science background is actually in animal behavior. That was what I studied at university and what started me off in an academic career. When I left academia, I moved into the UK's charity sector. And I've spent over a decade now working in various scientific and medical charities in the UK in a number of different roles, focusing on areas such as public engagement with science, with education policy, with research funding, with how you communicate research to the public, and various things like that. And about 3 years ago, I joined the Multiple Sclerosis International Federation. And this was actually my first interaction with multiple sclerosis and with neurology as a wider field. So I suppose I came into it really with my experiences with working with how you bring together, I suppose, a variety of people from different areas, whether they are researchers, whether they are people with a clinical background, whether it's people who are affected by different diseases, whether it's the general public. How do you bring those people together to have the right sorts of conversations that lets us find out what are the biggest challenges that are facing people in this science or research area and what needs to be done about it? And that's what I really have enjoyed throughout all my different roles, and is what I'm really, I suppose, focused on in my role now as head of research and access at MSIF.
I got a lot of questions for you, Anne, but there are a few things that is coming to my mind. As you know, I don't prepare myself for these interviews. I like to go with the natural flow with the person who is he's sort of a key star in that interview. Among many great things that MSIF has done, one of the moving and very impactful thing is Multiple Sclerosis Atlas. When I look at the Atlas, the way that you all went about it and making connections from these countries, having traveled virtually and physically in many parts of the world, knowing that some neurologists are incredibly challenged with a whole lot of clinical work, you still cut across to the large portion of the world, well, almost all over the world, getting reasonably validated data that is telling us the reality. This has a lot of learning for rest of the others. The reason that I'm asking this question is when we set a World Brain Agenda up, our aim was very much similar to what you just said. We realized that we can't quadruple neurologists suddenly, but the brain disorders are still the leading cause of disability and second leading cause of death. We felt that our job would become easier if we bring much needed synergy among people, and if we convince them that promoting brain health is a matter of interest for everyone. Then they all can do their bit of health also, because there is no health without brain health. That was our ambitious agenda a long time ago. Little we knew that within 8 years, we would be reaching out to 100 million, 150 million. That was beyond our belief. But I see a lot of value of learning how the MS Atlas work and how you get these people to make positive contributions with a reasonably short notice, which is basically telling us the reality and truth as best as you can extract, because that is what is most needed before you fix anything. You need to know what is happening out there. And we now tell people that 70% of the countries in the world cannot access medications that you would talk about later on, cannot access early diagnosis. We proudly throw those questions at others thanks to Multiple Sclerosis Atlas. So my question is, how do you get these different craft groups, different countries, different challenges? I mean, I'm working the cold phase, and when you go and do a ward round, when you the things you can't really plan your day. Basically, one family can basically throw you out of all comfort zones, and everything that you plan for the day can go out of the window with one unexpected clinical challenge. This is from Australia, which is reasonably well funded and well supported. But having traveled all over the world, I know that there are other countries which are unbelievably less supported compared to us, but you still get very useful data from those countries also. And I have spoken to some of them, and they're incredibly the happy and delighted to be part of that. So how do you do this?
Yes, that's a good question. Probably a couple of things to pick up on what you've just been saying there. Your point about how essential having this type of data is for any work that's maybe needed to happen at a national or local level to try and drive change, actually understanding the situation on the ground in terms of the numbers, who has MS or any other type of neurological condition, how many people are there and what type of MS do they have. That's so essential for planning what's needed at a health system level in terms of access to diagnostics and treatments and healthcare professionals. So I think that at the start, we're able to, I suppose, make the argument for why having this type of data is important. But then, as you say, even when that premise is acknowledged within a country, trying to collect that data is incredibly hard, no matter where you are in the world. But in some places, it's even more challenging than others. So I think, we really commend everybody who is involved in these efforts in trying to collect this data that is relevant to their country, to their national setting. And I know that you've spoken earlier on to my colleague Rachel King, who is our lead in MSIF and has really project managed and coordinated the whole Atlas of MS project, and has been incredibly persistent in trying to make these connections to people all over the world. And for the two modules of the Atlas of MS, the two surveys that we have run and collected data on already, we really focused on trying to make connections where possible with researchers in the country that may be collecting epidemiological data, or with clinicians they were often our contact point. And again, I suppose we tried to make those connections through a variety of different routes, sometimes going through networks, such as the World Federation of Neurology itself. You have national contact people for neurology. So we made use of some of those connections. There was a lot of, I suppose, even just searching through the internet, trying to find people who are active in the area of epidemiology or who are working in neurology in some countries. When we have the challenge that there are some countries in the world who do not have any neurologists. And so in there, how do we try and find any information about what's happening in terms of multiple sclerosis there? So it's really trying to build on any types of connections that we have. asking people where we do have a contact, do they know anybody in this particular country that might be able to work with us? And really just trying to build up those contacts on a personal basis, and asking them whether they would be able to work with us and to share any insight that they have. And then we hope that as the Atlas of MS project continues, I mean, it's been in existence, as you're aware, since 2008, but we're hoping that we'll be able to continue to work with those connections that we've built through this edition of the Atlas, and continue those relationships, so that as and when new data becomes available and we get new insights, we can continue to update the Atlas of MS, and it can be a resource that grows both in terms of the number of countries that are represented, because there is always space for more countries to participate in that, but also in the amount of data that we have and the quality of that data as well.
I think you are spot on. I was getting an Uber driver to drop me this afternoon in between clinics to pick up my car, which needed something to be fixed. The driver was quite chatty, and throughout the journey, he was basically trying to remind me how terrible human beings are and how inhuman we have become during last 18 months. He was giving me one example after the other, one example after the other. I did not want to divulge I myself as a physician at that time, but I try to paint the picture that while there's a lot of inhuman things that we hear in news and read globally, there are a whole lot of amazingly human things that is being happening over last 18 months, including MS Atlas and including World Brain Day campaign and many other things. I think science has really put us together globally, much more so than ever since the pandemic began. Last time when I checked, we have almost close to 200,000 publications in PubMed on COVID-19, and plethora of them come from neurology also. And the other thing is people share data liberally. And we did end up having vaccines within the first 12 months of the pandemic. I think the progress that good humans made in this world is absolutely amazing. And World Federation of Neurology was very keen when we set up the Global Neurological Alliance, which Multiple Sclerosis International Federation is part of, that our way to tackle these problems is by working together and bringing this much needed synergy. So you're absolutely right. We just have to keep on making connections and making them work and somehow get us together into a common platform. The various disease groups, various disease crafts. But when we promote health, the overarching theme is we are promoting brain health, irrespective of the disease craft group that we select at an annual basis. That gives me my second question. Having worked in the field of multiple sclerosis for a number of years, having worked in research and access, as I mentioned out, quoting your own atlas, 70% of the population or 70% of the countries cannot access either diagnosis or treatment. My first question is, how excited are you to see a World Brain Day campaign almost immediately after World Multiple Sclerosis Day, within few weeks, continuing that advocacy campaign, knocking doors and reminding people and talking about MS and talking about stopping multiple sclerosis, because our therapeutics are so advanced over and above every other aspect in neurological disorders. Yet we can't basically offer that access to most of the patients. My first question is, how excited are you to see this campaign? My second question, I'll throw that also at the same time. Having seen at Chatham's, the G7 summit leaders wanting to promise access to vaccine globally, recognizing the COVID-19 pandemic as a global threat rather than a national issue. Do you think our advocacy campaign making a noise to promoting or the asking them to consider a similar sort of a line to bring much needed essential medications as a right or access globally rather than concentrating on individual countries. After all, it is one health, one brain health. Or do you think I am asking for too much from G7 leaders and powerful nations?
Right, that was a lot of questions together. Let me try and take one at a time. So firstly, yes, very excited for World Brain Day and very pleased that the World Federation of Neurology has chosen the MS International Federation as its partner for this year, to really focus on issues that are relevant to multiple sclerosis. And as you say, a lot of these are challenges that are faced by many other neurological conditions as well. In particular, I think having a campaign like World Brain Day, which is specifically about raising awareness of a specific condition, is a really important first step in terms of advocacy and making change. Because without raising awareness of the condition and how many people across the globe are affected by it, and also the fact, I suppose, getting people to understand what it's like to be somebody who has a particular condition, trying to break down barriers and remove stigma around that condition as well. And I think for us, the issue that you've been talking about in terms of access to treatments, what we really want to highlight through this World Brain Day campaign, but also other activity that MSIF is involved in, is the fact that there are a lot of effective treatments now for multiple sclerosis that can slow down the progression of the disease and really help to reduce the impact of disability for people who are affected by that condition. But as you mentioned, from the Atlas of MS, over 70% of countries face challenges for people being able to access those effective treatments. And so that's a real issue that we need to tackle, and we need to tackle it in a variety of ways. So you were mentioning about actions that are being taken currently to try and ensure that the COVID-19 vaccines are made accessible all across the world. Now, in terms of, I suppose, MSIF's approach to how we would look at access to treatment for MS drugs specifically, again, I think there's a number of different routes, and this is something that can be addressed on a global level, but will also need to be tackled on a national level as well. I think global approaches are not going to solve all the problems because health systems are so complex and the challenges that individual countries face may be very individual to them. So at a global level, one of the things that we can do is to try and get MS treatments onto the WHO's essential medicines list. At the moment, any treatments for any type of neurological disorder are very poorly represented on that list. And there are no approved treatments for MS on that list at all currently. So the approach that we will take is to conduct a very thorough review of all treatments available for multiple sclerosis, whether they have regulatory approval, but also recognizing that there are treatments for MS which are used off-label in countries as well. So we need to take those into consideration as well. And once we've done that sort of thorough and independent review, we hope that we will then be able to provide some guidance as which are the really essential medicines that we recommend that all countries should make available to people with MS. And then, of course, that's just the recommendation. There are many more stages that need to be done in terms of how you actually get that implemented in countries. Even because a particular treatment is on the WHO's essential medicines list, it's not necessarily easy for countries to make that accessible if, for example, those treatments are not supplied to the country, or because of costs. A lot of these treatments can be very high cost, and that can be difficult for the health systems, for the ministries of health to afford, and not to mention complexities in terms of different types of insurance and paying systems within countries as well. So there's a lot of issues that we need to look at concurrently in order to try and solve this challenge.
And to add a little bit more positive spin to what you just said, which are all very valid and equal point, I'll add two more things. I met certain people that were supported by Multiple Sclerosis International Federation to move between various countries to get additional extra research training, and some of the stories that I heard from them, which will be posted in WFN YouTube channel in due course as part of this year's World Brain Day package, they were able to address some of those issues that you mentioned just now locally. And my second, the positive spin that I wanted to add is the concept of essential medicine was actually created for the World Health Organization by one of the most unlikely heroes. He was a young boy who was born in rural Sri Lanka a long time back. He then went on to do medicine. He then went on to do a PhD under Commonwealth scholarship in Glasgow. He passed away some times back, and I was invited to do his 40th commemoration oration with a medal a few years back. So I had to study his biography as part of this, as he and me come from sort of more or less the same rural hometown, the different villages, but same area. You wouldn't expect someone from that sort of area to become a game changer. But he then, as he became the first professor of pharmacology, he had strong political connections to the then Sri Lankan government. He proposed to the health minister that one of the key ways that the country like Sri Lanka can tackle this is creating the most needed medication list that he named as essential medicine list. That's how this began. And then it was embraced by several other countries, Bangladesh, Australia, and WHO. In fact, before he passed away, I think he was largely working for WHO. I put this positive spin story with most unlikely person doing that to remind our viewers that if you put your heart and soul into a good task, there is nothing impossible in this world. As I said, this very World Brain Day campaign, although we didn't expect that it would fly to 100, 150 million people, we knew that if we get something going, the possibility for us to put everything together was within our reach, and it is indeed happening, as we can see now. So I am hopeful that some of the positive things that we learn out of this pandemic would help us to tackle brain disorders, including MS, and we should be able to, just like we share rest of the knowledge and other things, hopefully during our lifetime, we would address this access issue by all those sort of multi-pronged approach. We just need to have the desire, and we just need to continue to build networks and make a strong voice. There's always sort of generic medications also that we didn't touch upon, and they would be humans are a smart group of animals, if you like. Finally, I tried to point out to the Uber driver, despite without divulging who I was, that we should not lose hope, and there are enough decent, good human beings who would get us through this crisis eventually to a much better world. I'm eternally optimistic. I think we would have to see a much better world as we come out of the other end. When you look through the history, after Spanish flu, our ancestors did well. After AIDS crisis, our ancestors did well. After World War I and II, despite all the carnage, we did well. You look at Germany, look where they are now. The people leave history behind, and they learn good things out of them. With regard to research, why do you want to drive home that despite the immense advances that the multiple sclerosis field has made, that this must continue?
Yes, so as I mentioned, there are many effective treatments for MS that are available, but they are not available and effective for everybody with MS. So the treatments that we have, most of them are very effective at tackling inflammation in MS and reducing that. But there are many people with MS who live with progressive forms of MS, where their MS is no longer active and inflammatory, but their nerves are degenerating, and we do not have good treatments that can stop that neurodegeneration or indeed repair the damage that has been done. So a lot of research, there is still a big gap in terms of the research that is needed to focus on issues such as remyelination and repair, and really tackling those progressive forms of MS. So the big global initiative that was established several years ago to really focus on that issue is the International Progressive MS Alliance. And that has been funding a lot of research into these challenges, really trying to understand the biology and the pathology behind progressive MS and to identify new targets for treatment. And again, it was recognized that this is such an important challenge and such a complex one that it needs a global approach, which again, I think really fits with the spirit behind World Brain Day and the fact that you need to bring people together who have different areas of expertise, different resources, to bring these people together to have the necessary conversations to identify what are the most important challenges and how do we go about solving them. And so there's a lot of exciting stuff that's coming out of the Alliance now, as I'm sure you will have been hearing, and that will be continuing into the future. Currently looking at what the next phase of science and research and funding is going to look like with that initiative. So that's one example of why research really needs to continue in this area.
And my other series of questions are going to be around the current pandemic and multiple sclerosis. I know that you've done a lot of work, the collecting and trying to answer the questions that many people raise. Last night I interviewed Royal College of Physicians President or Chair, Professor Alan Goddard, and Professor Goddard. He's a gastroenterologist, but he mentioned a few things that the multiple sclerosis, the immunomodulatory medications, potential involvement from COVID-19 vaccine, potential involvement of COVID-19, which basically a timely reminder that it is a sticking point for everybody, MS patients as well as any physician for that matter. I think it is worthwhile spending some time busting some myths around this topic and what we know about. So give us a snapshot summary of what's the sort of a take-home message for MS patients as well as treating physicians, the relationship between COVID-19, the disease itself, and then vaccination. You could tackle one at a time.
Sure. So yes, when it comes to COVID-19 and MS, the first thing actually I wanted to mention was how this, I think, is a very, again, a positive story of how globally people came together really quickly to try and address the challenges that people with MS were going to be facing. It was realized very quickly that we didn't know whether people with MS would have different outcomes from COVID-19 infection, for example, or what the impact of the COVID-19 vaccines on people with MS would be. People affected by MS and their families had an awful lot of questions that they wanted to be answered, and their treating physicians as well. So the MS community needed to come together very quickly to work out how they could start answering these questions. And even until that point when we were getting some data and evidence through that would answer those questions, what was the best advice that we could give people right now? And so as MSIF and working with various partners, we set up two initiatives. One was around trying to collect and share data that might help to answer those questions. So we worked with the MS Data Alliance, which is able to provide the platforms and the technical expertise to allow various data initiatives and people with MS from all over the world to contribute data, share data which could subsequently be analysed. and then working with our research and clinical experts, again, from across the world, to provide global advice for people with MS. And this could then be adopted and shared by MS organizations around the world, and translated as needed as well. So in terms of, I suppose, some of the key messages, or what we've found out about COVID-19 and MS, is that in general, people with MS are not affected worse by COVID-19 infection unless they are taking certain disease-modifying therapies. And we're seeing some signals that certain disease-modifying therapies can result in a more severe course of COVID infection. So the advice was then, for if you are taking those therapies, that you probably need to take additional precautions to try and protect yourself from infection. And then in terms of the vaccinations, the key message that we really want to emphasize is that everybody with MS should have a COVID-19 vaccination. There is no indication that these vaccines cause worse side effects or trigger relapses for people with MS. And the risk the risks from COVID-19 infection are much greater than any risks of side effects from vaccines. So everybody that we speak to is in agreement that getting vaccinated is really crucial. I think the interesting area of research that is being looked at now is around the effectiveness of vaccines for people with MS who are taking certain types of disease-modifying therapies. Because for the body to have an effective response to vaccination, needs to interact with your immune system. And if the certain disease-modifying therapies are dampening down your immune system, you may not mount a good immune response when you receive the vaccination. However, as usual, the picture is complicated because the immune system works in different ways with B cells and T cells, and we don't yet know the full picture about how the immune system of somebody with MS taking certain disease-modifying therapies, how that interacts with the vaccines. So, for example, we know that some people may have a much lower response in terms of their B cells. You may not get a very big signal in terms of that, but your T cells may still be active and may still be mounting a response in relation to the vaccine. So we expect that everybody would still have some degree of protection from the vaccines, but we don't know the extent yet. And until we start collecting more data from people with MS who have been vaccinated, we're not going to fully know the answer to all of those questions. So as I said earlier, the best advice is to get vaccinated, but it may still be important to continue to take some precautions, protecting yourself from potential COVID infection at the same time. Say
newly diagnosed MS patients in my hospital in Australia, basically largest number of MS prescriptions actually go out from my hospital catchment area. Unfortunately, the way that the political system works is that health network is basically catering for largely working class, multicultural, linguistically diverse population representing well over 166 countries. So our department is probably the least funded and supported department. So I think normally we see anything between 2 to 3 new patients per month, newly diagnosed. I was told by my colleagues that that's almost doubled throughout the pandemic, but this is one health network, different diverse patient population, so we can't make any decisions on the basis of that. But my advice to those newly diagnosed MS patients, when I am on ward or clinical duties, we all share the workload, is get COVID-19 vaccine first, flu vaccine second. Is that a reasonable, rational advice, you think? My approach is that I want them to be, we can access all medications in Australia, despite our hospital department is underfunded, medications come through national government. So we could basically prescribe anything under the sun under sort of a government protected scheme. So patients wouldn't pay a cent if they are low income earners. So they're incredibly lucky in that regard. So most highly active disease patients get highly active therapeutics. So my logic is I want them to be protected early on before we go and hit them with immunomodulatory therapies. Is that the correct approach, you think?
So I think it probably depends on which exact disease modifying treatment you're offering. And I have to say, off the top of my head, I can't remember what the specific advice is in terms of the timings for COVID vaccines or flu vaccines and timings of the disease modifying therapies as well. But we have with this group of international experts, we have provided advice for each different kind of group of DMTs in terms of the optimal timings and optimal schedules. So we're hoping that that can then provide guidance to treating physicians about the best approach to do that.
Here in Australia, basically the time difference between flu vaccine and COVID-19 vaccine is 2 weeks. Normally, before you start them on DMTs, you have to exclude the rest of the other things, various other exposure to viruses and other things. So normally in my health network, that workup take a couple of weeks. So the younger people, if you could vaccinate them before you complete all those things, we don't force them, but that's the advice that personally I have been giving. Moving on to a different, the question, the COVID-19 illness itself, is there any sign or suggestion that it could be one of those infections that we would be suspicious of in time to come as contributory to potential MS, or too early to say at this stage of the pandemic?
I think too early to say. From what I've been reading or hearing, I haven't heard any indication that it could be a contributing factor towards MS in future. But questions like this really underscores the importance of why we need to continue collecting data and the importance of having registries where people with MS are willing to share data about themselves and about their health and about what they are experiencing, and to do this in a global way where I guess where data can be combined so that we can, because often you need to have a lot of data points, so information from an awful lot of people in order to be able to see some of these signals emerging. So for example, if that was to be the case where a COVID infection was thought to be a trigger for MS, we're only going to see that quite a long way in the future, and only if we look across an awful lot of people. So it really needs to encourage and support countries to develop and invest in registries and data collections, because that's how we will find the answers to these questions in future.
Absolutely. Our own department, we are very busy in neurology, but large portion of patients are having strokes, like many other neurology department. We were hit really hard from COVID-19, also really hard in the sense from Australian standards. As you know, so far Australia, touch wood, has not been hit terribly hard compared to other countries, not in the sort of a context of UK or USA or India for that matter. But when we were hit hard, we were the hardest hit. In fact, in my own health network, there was a time that we had well over 150 cases of severe COVID-19 daily. And I myself manage a large number of brain involvement in COVID-19. At that time, we put them into print. I think we published something like 33 manuscripts last year throughout the pandemic, as they were material to be shown and discussed. What we saw was quite incredible. We basically shown to the world that how brain involvement and immune systems behavior is very much similar after COVID-19 and brain involvement and acute stroke and rest of the other sequelae. those were the sort of largest number of manuscripts, at least for me. Most of my close network people have heard this. I always tell them that although I have been a medical folk for now 22 years, my biggest peak of learning was last year. I learned more medicine during last year than the entire career before. Those patients who passed away and those patients who survived with so-called long COVID or persistent symptoms taught me heaps more. The reason that I'm sharing this is again to drive home the message that you just said, that if we were to see that better world when we come out of this pandemic, we have to somehow translate these calamities into new knowledge and new information and guide us through the process promoting brain health. Let me change the interview to a slightly different angle. I know that you are not 24/7 doing science and access and research. Tell us about your personal life a little bit. When you don't deal with MS, how would you spare time? What do you do for the pleasure or joy? If someone Google about you, what can't they find unless you are prepared to tell about that now?
Oh, okay, good questions. So I have young children, so a lot of my time outside of the MS International Federation is taken up with family life. I live in London, and certainly when we're allowed to go out and about, we enjoy visiting the galleries and museums that London has to offer, spending time in parks and outdoors. I have a small garden and I love gardening, particularly at this time of year. Everything is looking, well, in the UK, everything's looking very beautiful in the sunshine. Again, gets me out of doors, which is important to me. I grew up in the countryside, so I love being surrounded by fields and nature, which you get a bit less of in a big city like London. So I try to get access to that where I can. So yeah, that's what probably takes up my time now.
My last question to you, Anne, is we do know that we want as many bright young minds as possible in all kind of specialties to be interested in brain, and the importance of neuroimmunology and the behavior of immune system is very clearly shown during last 18 months. And I think it will continue to tell us stories and teach us on the right direction for years to come. I'm reasonably confident that we will unravel amazing stories. So I'm obviously a converted person. Why do you think that young people should be interested in brain? And what are your take-home messages for young people, whether they want to be pure researchers, clinician scientists like us, or any other profession? What is your take-home message for them to get the best out of them to serve humanity?
Studying the brain tells us kind of everything about humanity. As part of my degree and sort of leading up to my specialism in animal behavior, I had to study both neurology, neurobiology, and psychology. And as part of that, we spent a lot of time actually, I suppose, doing experiments on ourselves, really understanding how our brains link to everything that we do with the rest of our body, but also on the psychological side as well, that interplay between the physical and mental sides of us as humans. It's the most fascinating area, and there's still so much more to learn. So yes, for I guess any young person who is interested in science and biology, I'd absolutely encourage them to, if they get the chance, to focus on neurology and brain sciences and psychology, and that, yeah, there's a lot of ways you can go with knowledge in those fields.
Absolutely. And I took a lot of time away from you. We are almost getting close to an hour. I think we talked about you, we talked about the issues with regard to access and how critically important research is. And we both believe in a fabulous future to the world despite the current pandemic. We are smart creatures in the world with a lot of kindness, compassion, and collaboration. I'm confident that we would get this job done. And both of us invite all our viewers to drop into World Federation Neurology website, drop into Multiple Sclerosis International Federation website, download our toolboxes, download all those social media posts, press briefs, browse these video clips, listen to some of these amazing stories, and promote World Brain Day. We really wanted to see 2.8 million social media posts, at least saying that you endorse World Brain Day and you support World Brain Day. And then I think we would get most of the work done by talking about it as first thing is to talk, and then comes the action. Any final thoughts?
No, I feel like we've covered everything, Tissa. Thank you very much for having me. It's been a fascinating conversation for me this morning. And yes, really looking forward to World Brain Day on the 22nd of July.
22nd and beyond, you know that this is a prolonged campaign. We then have another webinar at World Congress Neurology, then have another webinar at Extremes. So we will keep hammering this theme until we get most global citizens on board with the agenda over the next couple of months. Thank you so much. Stay safe and stay well. Keep up the good work. And we are incredibly happy to see the activities of Multiple Sclerosis International Federation. You are part of our Global Neurology Alliance. So we would be working together for a long period of time on this common agenda. Stay well, stay safe, and take care.
Thank you.